I know many of you have heard the words, you need to see a heart guy. You need to see a cardiologist. What if you heard those words as it applies to your children or your grandchildren? You're in need of a pediatric heart specialist. Where would you go? Of course, the obvious answer is Erlanger, Children's Hospital at Erlanger. Dr. Wesley Davis is joining us. He is a pediatric cardiologist. First of all, Dr. Davis, good morning, and thanks for joining us.
Good morning. Thanks for having me.
Tell me exactly what all encompasses the field of pediatric cardiology.
So it's actually a pretty wide-ranging field. Obviously, based on the name, it deals with heart problems in mainly children. But over the years, with technology advances, we've actually been able to do a lot in young babies, premature babies, even babies who are still unborn. We've been able to diagnose complex congenital heart disease in babies still in the womb, which gives us a better heads up of planning of how to handle things after babies are born.
And this is a fairly recent development, I would think. It can't be all that long where you can go into the womb and diagnose an unborn baby. Pretty phenomenal.
Yeah, it's pretty amazing to think about and really comes in handy. The opposite end of that spectrum is we still deal with teenagers and young adults who have congenital heart disease or other kind of heart problems. So we see a wide range for sure.
At what line do you start drawing the difference between, or should I say at what age do you start drawing the difference between a pediatric cardiologist and an adult cardiologist?
Oftentimes it'll depend on exactly what the problem is. I think a lot of times adult cardiologists deal with problems with heart function or how the heart's squeezing or heart attack kind of things, which is typically what most people think of. We in pediatrics actually deal more with structural problems, anatomical issues that babies are born with. So that has a lot to do with drawing the lines, but a lot of times it's kind of the usual pediatric cutoffs of 18 to 25, although if it's really complex problems, we'll still follow those patients well into adulthood.
Do you see a lot of congenital heart disease in your field particularly?
Absolutely. That's kind of the bread and butter of pediatric cardiology. Congenital heart disease is any structural or anatomical problem that a baby is born with their heart. And it's surprisingly common. I think the hard statistics is about 8 per 1,000 births. But for easy math, 1 per 100 babies born with some type of heart problem.
All right, here's a non-medical question. What do you and your team at Children's Hospital at Erlanger do, not just for the patient, but to make it a little bit easier on the parents as well?
Well, you use a great word of team, because it's definitely a team effort. From the time they enter the building to the time that they actually see us and some of our other team members. When they show up to clinic, they'll be greeted and then pulled back. Some of our staff, we have nursing staff, medical assistants, who will talk to them first, kind of get them settled and help make them comfortable while they're getting their vitals and initial questions done. We're a little bit different because we've got a lot of different types of testing that we can do in clinic, whether it's EKGs or electrocardiograms, echocardiograms, which is a specialized ultrasound of the heart. Each person, each one of those tests has a different team member. So it definitely is a team effort. And then finally you get to see the doctor, and we're kind of the final piece a lot of times.
Right. Dr. Wesley Davis, it's been a fascinating conversation. Thank you so much for joining us. Again, Dr. Wesley Davis and his team, part of the great pediatric cardiology folks, the pediatric cardiology team you will see at Children's Hospital at Erlanger. Dr. Davis, thank you again for joining us. Find out more. You can give them a call, or you can go to their website, which is childrens@erlanger.org. childrens@erlanger.org.